Yeah, let me just say it.
So I just know what to
Let me
do.
just say it. I'm gonna do this page. I won't do this. I'll do that.
Play the video.
I'll do that very
want
last.
to do the.
Yeah, okay.
Oh, yeah.
I see you know where you're
Yeah.
Alright, so you're working in the ER like before. You're the triage nurse, and you got Mr. Johnson. He is a 60-year-old gentleman complaining of heart palpitations. Okay?
Okay.
And you're coming into the room, so you walk into the room.
Okay. Hi, Mr. Johnson. How are you today?
Fine.
What's going on? Tell me what brought you in today.
My heart feels funny. Never had this before. I don't know. I'm kind of scared.
Okay, we're going to hook you up to a couple monitors and machines and get some pressures and vitals and blood work on you. So I'm going to have start an IV. I'm going to get a set of vital signs.
Okay. So you're getting vital signs. Blood pressure right now is 80/50. Your heart rate, what you see on the monitor. Tell them what you do.
We're going to give you 6 milligrams of adenosine.
Okay.
Okay, adenosine 6 is in, flush, and the flush.
All right. Pulse ox is 90%.
Okay, so we're going to do rescue breathing.
It's pulse
Or, well,
ox.
no, I'm sorry. We're going to put nasal cannula 2 liters.
Okay. All right. Hooked up. Ready to go. See?
Okay.
All right. So your first dose of adenosine didn't work.
Okay, now he's in B-fib.
Okay. So what do we got to
So we watched it happen, so we are going to shock.
do? Okay. We'll get to work.
Okay,
Right
shock,
away.
where's my shocker? Pads are on, so
Start CPR.
make sure everybody's clear. Oh, yes.
Okay, so are you going to shock or when are you shocking?
Well, we're making sure he doesn't have a pulse.
Just,
Check.
okay. Do you check your pulse?
No pulse.
No pulse. So we can shock, charge at 150.
Okay.
Charging 150.
Get off that turn.
Make sure everyone's clear.
Charged. Everyone cleared. Shocking. Shock delivered.
CPR starts.
Okay. All right. I want you to take over now. So you give her a report of what you've done. It's the same patient. Let her know
Okay.
what's going on.
Are
Are you
He
doing-
came
you doing
in
that with you? What's- you
in-
doing that with?
tachycardia. We
Well, he's
gave
not
him
breathing
6
now.
milligrams of adenosine. We started CPR and we've given him 1 shot at 150.
Okay.
I told y'all, 2 minutes is a long
That's
time.
a long time.
So what are we going to do? We're not going to stand around.
Okay,
Why-
why is he coming with tachycardia? Let's go over the H's and T's.
Okay.
Oh, we can get that on
You
here.
talk to the nurse here. What, she probably knows a little bit about him because she started with him. So
We can get a history from a family member outside in the waiting room.
families out there. Okay. Got a history of hypertension, COPD.
So hypoxia, are we getting good airway, good airflow, good chest rise?
Yes, good chest rise.
We can order labs.
Okay, go ahead and get some labs and order. We drop from the side if we need to.
What labs?
Let's do a rainbow.
Rainbow.
That's all you want to know. What gases?
ABGs, CBCs, BMP,
Electrolytes.
electrolytes. Well, it's not
Tox.
BMP.
All right. So we got all that drawn.
Start fluids.
Well, his blood pressure was normal, so we don't really want to push
10
fluids.
seconds to go.
Is he cold and clammy?
He's not breathing. He has
He's
no
not.
pulse. Yes. So he's not going to. You're
2
confusing him.
minutes.
2 minutes is
2
up.
minutes up, switch, let's assess, let's analyze.
Does he have a pulse?
Pulse.
No pulse,
Yes.
but he's in looks like normal sinus rhythm, but it's apparently PEF. There's no pulse. Continue with CPR. Okay, yeah.
What you want to do?
I'm gonna push him up.
Yeah, we need to push meds. We need to push a milligram of epi. You could drop a milligram of epi. Go ahead and push it. And let's get some amiodarone 300 milligrams prepared.
long are we on? And what are we doing? What we got?
55 seconds.
You're at 55 seconds there, because we got the
Okay.
amiodarone ready to go.
Okay. What are we doing? Pushing fluids.
We got fluids hanging.
Okay. Got lines going.
Mm-hmm.
Okay. Long 2 minutes, huh?
Long, very long 2 minutes, and we're waiting. We got the lab reports back, so we're still waiting.
Okay.
Does it seem like it takes that long you're actually in one though?
Well, most people don't realize, I don't think they can go a full 2 minutes.
No.
So it's important to go 2 minutes CPR. In between each, whatever it is you give. You give it a minute, then you really need to go to full 2 minutes.
Right.
Like,
I don't think, yeah, it doesn't seem, it seems like we're
Because what
constantly
you'll see
going.
happen is they'll shock and then they'll immediately want to know what the rhythm is. We don't want to do that.
Yeah, we don't shock on these, so.
All right. It's been 2 minutes almost.
Got 10
All right.
seconds left.
You'll take it over. You'll give it to this gentleman over here.
Okay, gentleman came in, he was tachycardic, they had pushed,
2
adenosine.
minutes.
2
The
minutes
shock
is up.
once.
Okay. There's your
Pulse.
rhythm. No pulse.
No pulse still, we had already given a amiodarone. Switch, you wanna go ahead and take over compressions?
Did we give the amiodarone?
No, it's
Oh,
ready. Amiodarone's ready to be pushed.
So what you gonna do?
We're gonna reassess.
Okay.
Does he have a pulse?
He does not have a pulse.
Is he breathing?
Analyzing. Reassessing.
Okay, no
Reassess.
pulse. That's your rhythm right here. What are you gonna do? You wanna shock or not shock?
Shock.
Okay. So let everybody know what you're
Okay.
gonna do.
Getting ready to shock. What do you want me to shock at?
200. What was the last shock we gave?
The first shock was at 150.
200.
Okay, shocking at 200. Ready, everybody stand clear. Shock delivered.
Okay.
Begin CPR. Get the adenosine. I mean the amiodarone ready.
300?
300.
Give or get it ready.
Get it ready.
It was already.
Well, it was, yeah.
Oh, it was already.
Because she had just completed.
Give. Amiodarone delivered. Line flushed.
Okay. Where are we at time?
40 seconds.
40 seconds to go?
No, just
Oh, wow.
40 seconds.
What's
So we
Well,
checked.
you done?
She gave amiodarone.
Yes. We've already shocked at 200.
Okay.
At this time, we're going to assess for H&Ts.
Okay, so
CVs.
go down that list.
Is he hypovolemic?
I don't know.
What
Is
was
he?
the history? I don't think there was.
What are you
No,
doing
there was no
for it?
history of hypovolemia.
No bleeding.
No
Are
bleeding.
you, are you giving him fluids?
Yes, sir.
Okay, all right.
Is he hypothermic?
Doesn't appear to
He
be.
doesn't appear to be.
Have we got the labs back yet?
No last back yet.
Okay. Does he have a
Yeah, just have, how's the oxygen?
How's the oxygen going?
oxygen? So he's not hypothermia. It's
Hypoxia.
hypoxia. Thank you.
So what can you ask? What do you want to ask her?
We want to ask the family if they're, or they already asked the family.
We were
Right?
talking about hypoxia, so what do you want to know? What do you,
Is there-
make sure that,
Is he getting adequate oxygen?
There you
Is
go.
his chest coming up and down? He's receiving
Yes.
adequate oxygen.
all right?
Actually, it did move.
I saw it.
Is it moving?
I saw it move.
No, it did move.
Where we at on time?
10 seconds left.
You
Okay.
can have him prepare another drug if needed. Have it for
Get a
vasopressin
epinephrine ready. 1 minute.
or vasopressin for you.
Vasopressin. We already gave epinephrine
2
twice.
minutes.
Once.
We
Okay.
get
If you
vasopressin.
can give vaso.
40
Right,
minutes.
so you did
So
vasopressin.
2 minutes is up?
Analyze.
All right.
Reassess.
Pulse?
No pulse.
Yes, he has a pulse.
Yes, pulse.
Normal sinus. What's his blood pressure?
His blood pressure.
Is he breathing?
Is he breathing on his own?
He's not breathing on
Not
that.
breathing.
Okay. Continue ventilation.
Okay.
I'll put an airway in. I'm sorry.
An advanced.
In advance there. Or what's
Advanced.
Let's
It's
get enough
advanced.
for right now.
Okay.
It's notional.
Yep.
What was the blood
Keep
pressure?
it simple.
What's the blood pressure?
80/50.
80 over 50.
So we
He's got fluids going.
We got fluids going. We're gonna.
Is he, yeah, your responsible.
Sir,
Is he responsive?
It's
not
not
responsive.
He doesn't have breath, so we're giving him air. He has normal sinus rhythm. Well, no, he's not. Oh, we cool him down?
Okay, well, what are you doing? You tell me.
Yeah,
Y'all run this show.
He's unresponsive,
Yeah,
so we're gonna do
Yes.
hypothermia.
So we're gonna well, since it's hospital, we're just gonna put ice under his axillaries, his growing area, keep him
Okay.
between a 32 to 34 degrees Celsius
Okay,
for 24 to 48 hours to reduce it.
okay. What else? Anything? Did you miss anything? I always love saying that.
Listen to his lungs.
Oh.
Hey, you gotta listen to his lungs, make sure the airways.
Well, you guys still got to think about the cause. Is there a chance of cardiac?
Well, we haven't got the labs back yet. I mean,
Do we have
everything
do we have a 12 lead?
We need a 12 lead.
So we did 12 lead, we get labs, we get those drawn, so anything else you want to do before you call it quits?
I'll call it quits.
All right.
I was like, just call for cardiac.
Yeah, cardiac cap.
Take a break.
How long since the epi?
4 minutes.
It's been 4 minutes. Good. Another dose of 1 milligram epi.
Okay, that'd be given. Flushed.
Okay, so we'll start CPR again. All right, start the timer.
I'm suspecting a STEMI, but I
Okay.
don't want to interrupt chest compressions for the 12 lead.
What's 12 lead going to show you?
Elevated STs.
No, it's going to show you what's... Right now, an underlying rhythm is asystole. That's what it's going to show you. So 12 lead is not going to work for you right
Yes.
now. So, we got to figure out how to get her back.
She's not hypoxic. She's not hypovolemic. Thinking cardiac.
So, work through your H's and T's. You're doing it. It's just good. How do you know she's not hypovolemic?
She's not bleeding.
Well, that's so okay, but it could be other things. So how do we know? So what can we do just because?
Start IV
There you
fluids.
Yeah,
go.
pushing
So
fluids.
let's push some fluids.
Some saline
Because
bullets.
what do older people do? They don't drink enough water.
She didn't eat breakfast this
She
morning,
didn't
so
eat
odds are
breakfast.
she's not drinking either.
Because she could be hypoglycemic too.
We
I already
check
got
the
the
sugar.
sugar
Blood
put
sugar goes
100.
Okay.
All right. Where are we at time?
114.
Okay. Anything else you want to do?
Not until I find out if we've got some kind of rhythm back. Epi,
Medicine running.
you can only give epi or I guess basal.
All right. So give your report to her. She'll take over.
2 minutes switch.
All right. So we're gonna switch roles. Switch. You got now. She's
Yeah,
taking
pulse.
over.
How is the airway? Are we meeting any resistance?
No,
Are
no
we-
resistance.
Okay, good airway?
Yes.
No hypoxia. Yeah. For pneumothorax or,
What would you suspect to be?
I guess no specific infection. There's no trauma.
yeah.
All right. Good. All right.
Get another epi, 1 milligram ready.
Everyone's ready?
What's the time?
Yeah, 6 seconds. 5.
2 minutes.
2 minutes.
All right.
Give
Pulse.
us,
She's on it. No pulse.
no pulse. Give another epi.
What is that rhythm?
No pulse, it's a PEA.
Very good. Very good. All right. So get back on what?
Compression.
You want?
Like
It's been maybe a minute.
whatever
Okay.
time is on there
Okay.
since the compressions.
Prepare the vasopressin then. And we want to get an advanced airway.
Why are we stopping CPR?
Oh, sorry, I thought it was.
Stats. Screws.
She did say advanced airway.
Yeah.
So what kind of advanced airway?
Do we realize that a priority? Is he working? Is it work? Is this bagging working right now?
It is.
Stats are good.
Okay.
Get
Oh,
compliance.
2 minutes.
99. Okay, switch. Check the pulse, please.
No pulse. So what have you done?
Here.
No pulse.
No pulse.
So what are we gonna do?
Oxygen. She's on fluids.
Those V-tech when you
Your
check.
team here is on there talking to you.
Okay. We're gonna
Okay.
prepare to. We're gonna prepare to shock.
I ain't
She's already
listening
had
to
the area left.
What are you gonna do?
We're going to shock.
Okay.
19, 19.
What was her last shock? Hit 300, so 360.
Sorry, at 3:30. Clear.
So start your timer whenever they shock.
Analyze,
Shot.
shock, clear, go. Compressions.
Getting all this. It's good. They're going to love to see this. All right, so what are we doing?
We are continuing to assess the patient, so if
Okay.
there's any other problems.
Okay.
The fluid has been addressed, the air has been addressed. We need to see how this response works. And if they come back.
So please come back. Please come back.
What do you do at this point in time? Start praying.
Yeah.
How many minutes has it been?
39 seconds.
How many minutes has it been total since we started on this scenario?
Yeah, we'll put it video.
30.
15 seconds left.
Sure it's quiet. I don't mind. It creates disaster.
No.
30.
Do we have our labs back?
2 minutes.
Labs.
Of course not.
2 minutes. Let's analyze. Analyze it.
Rhythm.
We've
Yeah,
got
have
a
a pulse.
rhythm. Do we have a pulse?
We have-
Yes.
We have a pulse.
We have a rhythm.
Are they breathing on their own?
They are not breathing on their
Not
own.
breathing on their own.
Now we can do the
Continue with the airway
Okay.
Check responsive.
and check responses. Are they responsive? Hello.
So,
It was for you.
no response from the patient.
Okay, at this point we want consult and we want to consider icing them down to slow everything down and continue to assess any of the H&Ts to make any corrections. And did we ever get our labs back?
No. I'm not going to go through all that.
Okay.
Okay. All right.
Continue to monitor.
What did she do? Overdose on her betas?
Probably. All right. Anybody have any questions?
Sorry.
It's not as bad as you thought, right? Team, she may not have the answer, but somebody in this group should have the answer. Somebody should know what's going on. And if you see something that's not right, you need to speak up. Because we as nurses, we can do that. Doctors are not always right, so you speak up.
I have a question. Should we have given the epi when he was in VTAC, right?
I don't remember.
Okay, good.
I'm not gonna, I'm not expecting perfection. I'm just, I just want to see y'all work as a team to work through things. I hear somebody yelling, analyze. I hear somebody saying, somebody wanted to give amiodarone. No, we're going to give epi because that's what we're supposed to give. That's what you got to do whenever you get out there in the real world. You see it, you know what needs to be done. You need to make sure you're the one who needs to speak up and do it. Because if you know it and you don't say anything, you're just as wrong as the doctor is that's running this code. Okay? All right.
Perfect.
Now let's see where y'all supposed to go next. I think they'll go to review.
I believe it's plan of attack.
I believe this one.
I believe.
Oops, sorry.
We're going to work that way, and then I'll get to somebody else until we're all done. Okay? Everybody's going to have a part, so whoever's the team leader will assign roles. CPR, airway, timekeeper. If you need to borrow my watch, you can. We're going to use real time, so in between your assessments, after you do one assessment, we'll start the clock, and that'll give you 2 minutes. And then you can do, after 2 minutes, your timekeeper will tell you, and then you do your thing. Remember I said 3 things, right? You check pulse, check your rhythm, and decide what you're going to do. You're going to get medication or not, okay? All right, it's real time. If y'all stand silently, I'll stand silently with you, okay? Okay, so, and with that said, you're going to go first. So, I will give you a scenario. You got your people here. Okay, I know we're going to be short because we don't have as many, so I can take the role of maybe airway or something, whatever you want me to do, okay? All right, this is whoever you want to assign timekeeper. Here's my watch. They know what to do, okay?
Chest compression.
So, I'll do chest compression.
I'm just teasing.
Okay?
Okay.
So, that being said, why don't you keep the time? That way I can do
Yeah, I think that would be.
To a point?
Yes, you can help.
To a point?
Yes, to a point. I don't want you going telling her everything. I want her to make some decisions. But yes, if she says the wrong drug, I expect y'all to speak up.
Okay.
Okay? I expect you to say, no, let's try it. You know, in a nice way, obviously.
Right.
We're going to try this. Let's try this instead of this. What do you think? Type thing. I always put the thought back in them. You're like, what do you think, Doc? You want to do this? Let's try this instead.
Right.
You don't want to try to make them feel like a fool.
So she's a doctor?
Yeah, she's a doctor.
I'm a doctor.
So, all right, so you're the triage today. You're working triage. And we have Miss Johnson. Miss Johnson comes in, and she is a 55-year-old female, and she's feeling weak and tired. And she's been like that this morning. Husband said she didn't eat breakfast. She always eats her breakfast every morning. Today she didn't feel like eating. So, and then she said she was weak and tired, so he brought her to the hospital. And voila, you walk in the room, and she'll sit up and talk to you, whatever you want her to do.
Okay. So she is...
So you walk in the room, what do you do?
Hello, ma'am. How are you?
My name is Nurse so-and-so.
My name is Nurse Crystal.
Okay.
They brought you into the hospital out here because you're not feeling well?
Yeah, I haven't been feeling well this morning. I woke up kind of weak and tired.
Okay. So I'm looking at the monitor.
We haven't done anything yet.
Okay.
Let's do all that stuff.
Okay.
Okay?
All right.
We'll pay attention to this.
Okay. So let's get a set of vitals.
Okay?
Okay. I'm going to put her on the monitor for you.
Okay.
Okay. And put her on the monitor.
Okay, so we got her monitor. Blood pressure is 80/50. She's breathing about 22 times a minute.
Okay.
That's what you have on the monitor. You got your group here. Everybody's willing to help you.
So this is what we're working with, right?
Yeah, the
Sorry,
sats are
okay.
about 92%.
Oh, so it's not correct yet.
Yeah, he'll fix it.
Okay, so we'll just wait a second.
Okay, so our sats are 92%. She's breathing 22 times a minute. Her heart rate is what you see. Get your team here, they all can help you.
Let's get the defib. Let's get the defib pads on this
Okay.
patient,
Just in case.
just in case we need to pace, if we can.
You can go ahead and give her a med,
Okay, what would you like to give her?
atropine,
Okay, how much?
0.5.
Okay, so we give her 0.5 of atropine.
You got that?
I'll put
She
that in
has
her
that.
IV,
Okay,
and I think we need to get
Okay,
her.
let's we'll start. I'll start compressions, or
So that's a
You're
defib?
gonna start compressions.
what else you want done?
Oxygen.
Okay, so you want to breathe for her.
Okay. And we need to
Somebody, there
get
you
an AED, so let's
Well,
give
they were
her.
going to put it on her.
Okay. So we start the clock for, or start the machine.
30.
Oh,
It's all you.
go ahead.
What do you want to do?
Has it been 2 minutes yet?
Been 17 seconds.
Okay.
Okay.
Continue
Keep going.
CPR.
It sucks. 2 minutes is a long time. But you can do this, okay? Rather
We
than
have a
start
normal
CPR.
chest rise.
We gave atropine, okay, defib.
Have you done anything else?
Like labs?
I don't know. What do you want to do? What do you need to do?
How do you want to
Okay,
do
talk to your team.
Oh, I thought we
30.
started the machine. Yeah, okay. So turn on the machine and.
Okay. This is your machine. This is your machine right here.
How
Okay.
much are we gonna get?
So can we go ahead and
So you
shot?
Okay.
You got a shot, you're going to pace them. Oh, yeah, you're in shock now. You need a shock. I'm sorry.
Okay. So we shock. What do you want to
How
shock
much
at?
do you want
Can I pull
Team can help you out.
100.
to do? Keep going.
Everybody agree with the 100?
150.
No, 150.
150.
Okay.
Okay.
So hey Doc, how about we're gonna try 150?
So
Hey,
now-
Doc.
Oh, 150.
Hey, Doc, let's try 150. Have you ever thought
All
about
right.
150?
So
It's charged.
all right.
The patient's
Y'all
pulse
walk-
is,
y'all
we may
talk
want
through
to shock
this.
him one more time before we consider him Otto.
Okay, let's shot them.
So what are we doing?
Let's
Okay,
get
clear the
the,
patient.
let's clear the patient.
Okay.
We started the shock. Everyone clear?
Okay.
Clear of shock.
If you want to switch roles.
Okay, let's go. Let me know if you want me to switch.
So we started. So now we're resetting. Okay. So now we're doing another 2 minutes. Okay. So what are we gonna do now?
After 2 minutes, we're going to assess and see if we have a pulse. Okay, patient came in with low heart rate. We administered atropine. We shocked them. We also administered amiodarone. Or no,
atropine. We administered 2 doses of atropine. Or 1 dose. No, oh no, we shocked them twice. And we 1 dose of atropine.
And patient still unresponsive.
Yes.
No, I'm telling you.
Okay. Okay, then I guess we'll switch off and,
Okay.
do you want to switch off now?
So now you're the team lead and she's
Okay.
your dandy nurse.
Okay, so now we're in, let's reassess. We're waiting for our 2 minutes to be up.
Okay.
Are we,
You got 30 seconds
we got
left.
30 seconds left. Looks like our heart rate's changing, and it looks like we're going, we still don't have,
Up.
Hmm?
Right there.
Okay.
Okay,
we're gonna,
2 minutes.
okay, we're gonna reassess. Wow, we're gonna want to.
Does she have a?
She doesn't have a pulse,
She doesn't
so
have a pulse,
she's in a
she's in a
systole. We need to shock her again.
Everybody agree?
No,
Yes.
systole you don't.
Oh, it's
Oh, no.
PEA. It's PEA, so pulseless electrical. We're gonna use epinephrine.
Is it asystole or PEA? I heard 2 different ones.
A systole. So
Yeah,
we're
she
gonna.
was just touching her. That's what caused that. So now that you got everything off your patient, that's
CPR.
Okay, we're gonna
CPR.
want to continue with CPR,
CPR.
and we're gonna give epi, and we're gonna give 1 milligram of epi via.
Are you sure you want to give 1 milligram, doctor?
Or 1.
Yes, 1 milligram. You're absolutely correct.
We're gonna want to give 1 milligram of epi.
Okay. Epi's given.
okay.
Okay. And we're
Start
gonna.
at 2 minutes.
And we're going to reevaluate. Looks like her rhythm is changing.
No.
Because I'm
No,
given
it's
to
given to the
You don't look at that monitor. Do I need to cover it up again?
for the 2 minutes. So we're going to give the compressions
I got it.
and oxygen for 2 minutes. Thank you. If she has hypovolemia, we would possibly give her fluids, maybe some packed red blood cells, or.
I don't see any. I
blood
don't see any
clots.
pooling,
blood.
doctor. I don't see any pooling. I don't see.
Did she
She's
come
not
in here
bleeding.
with any long-term sickness as far as
Did we
diarrhea?
draw blood? Did we draw blood for electrolytes? ABGs?
We should do that.
Okay.
Um,
labs.
Let's pull labs.
Yeah, let's pull some labs. Let's draw electrolytes. Let's get a history as far as like if the family member knew she came in with diarrhea or any other things that may be causing an electrolyte imbalance. The other things
All right,
that
it's been
could
2
be,
minutes.
was she on any toxins?
2 minutes.
If she was on any toxins, we'd use Narcan.
We have a pulse.
Yay. It's back to 78. That's
You have a pulse?
good, but we don't have a pulse.
Yes. You're going to
One
put
of our-
ice packs
our
under the
target
arms, behind the
temperature's
neck,
32
in
to
the
34.
femoral area. And now, STEMI. We need to determine whether this is STEMI or not.
So we need to go maybe do some troponin levels and
Yes.
some
Yes.
MCKBs.
Yes, but we should be able to tell. And we have an elevated ST. Is that an elevated ST? I'm not looking
No,
at
it
that.
looks like a normal.
But what other EKG could you do?
I want to do a 12 lead.
There you go.
So we need to put a 12 lead on her.
12 lead on her, so we can see that. Okay.
He comes in, he's complaining of palpitations. He says, my chest hurts, I feel like I can't breathe, and EMS brought him in. That's all he knows.
Okay. I need to get some vitals.
So you walk into the room and you say, hey, Mr. Johnson, I'm a nurse.
Hi, Mr. Johnson. My name is Jennifer. I'll be taking care of you today.
Okay.
I'm gonna ask you a couple questions.
All right.
How do you feel right now? Are you feeling any
I
pain?
feel, well, yeah, my chest hurts, I'm a little short of breath, and I feel like my heart's, something's wrong. It's just like it's beating really fast.
Okay.
It's really funny.
What were you doing whenever this started?
I was sitting in my chair watching Grey's Anatomy.
Okay.
So,
Okay.
yes.
We're gonna go ahead and get some
I just said
vitals
General
on
Hospital.
you. We're gonna get some vitals.
Okay. All right. So your blood pressure is 80/50. Heart rate is fast. You can't even palpate it, but you can't even count it.
Okay.
And respirations are 24.
Okay. Can we get him hooked up to a monitor, please?
Yes.
And start some oxygen. What was his O2
Okay.
again?
What's that?
What was his O2 again?
Did
Oh,
you say?
two sat, you didn't ask. You
Okay.
want it?
Sure.
It is 91%.
91%. Okay, we'll give him some oxygen.
How are you going to give you? Oh, get that
Oh,
mask off of me.
we want to get nasal cannula.
Man, I don't want that mask on my face.
We want to get him a nasal cannula.
Okay.
Okay. Let's see.
Just ready to jump in there with the
Do
CPR.
we
You
have
know
him-
what's coming.
we
Yes.
have him on the monitor yet?
Yeah, he's on your monitor.
Okay.
Your team member, did she not tell you?
Okay.
Yeah, I
Okay.
I applied
Okay.
it.
Okay, I'll just. Is that what we're working with?
That's what you're working
Okay.
with. That's it.
Alrighty. Okay. It looks like we have.
My chest hurts. Gosh.
Okay.
Can I lay down? I need to lay down.
Oh, okay.
Can you lay the stretcher down? I don't feel
Okay.
so good.
Did you start the IV?
Yes.
Oh,
Okay.
man, I don't feel so good.
Okay. Dang.
So
Okay.
we could
So-
maybe
I
ask
feel
them.
really
What
dizzy.
about, if we could try the vagal maneuver for this SVT?
I don't even know.
You think we could do
He
that?
just looks at you now. He's not even following
Okay.
your commands.
He's not. Okay.
Sir, can you respond to us?
He looks at you, oh, and then out.
So we're not, the vagal maneuver is
Okay.
gone, that's passed. So now we're gonna go to, should I?
No pulse.
No, I'm fine. So
We
we're
don't
gonna,
have a pulse, so we're gonna start
we're gonna shock,
compressions.
we're gonna shock.
Okay, let's go ahead and shock him.
Okay. Let's
150.
Okay, let's get the pads on. Let's get the machine started.
Everybody clear?
Okay, so you
Clear.
shot.
Shock
All right.
him. Okay, so let's. Warren, can you start compressions, please, and make sure that he has an airway.
Okay.
Then we're gonna start him. What do you think we should give him?
Let's draw some blood.
Oh, yeah.
Let's draw some blood and find out what's going on.
Okay, we're gonna draw some blood.
No pulse.
No
Okay,
pulse.
then we
Okay,
can
continue compression. Oh, we're gonna let's shock him again. All right.
What is that
No,
rhythm?
no pulse. So we're gonna continue.
What is that rhythm?
It's the ventricular defib.
Okay, defib.
Okay.
That sounds good to me. So what are you going to do? Three things. So you've identified it. Do you shock it or do you not shock it?
Shock it.
Okay, so you know you're going to shock it.
Okay, let's do a shock at 150. Do we
Okay.
wait till after the?
No,
Fair.
you
Okay.
need to just do it. You got to do it.
Okay, everybody clear? Shocking 1, 2, 3. Okay,
Start.
All right,
So
so
let's
start
start
the
clock
for 2
again.
minutes.
So, all right. What are you going to do? You've done two things. They're always do three things.
Doctor, did you want to find out what his history was as far as before he came in here? Or
Three
his,
things.
Three
What
things,
do you do?
three things.
His age?
Check your pulse. No pulse. You shocked. What's your third thing? I always tell you.
Medication.
So you've given epi. So what do you want to get next?
And we got to run
How much?
300.
Okay. Now.
Let's check those labs.
Yeah, the labs and what was
Okay,
this?
we're going to figure out what's going on with him. Does he have any bleeding anywhere?
I don't see anything pooling, I don't see anything on the bed sheets.
What were the labs?
Where's his oxygen levels at?
What is his O2?
O2 sats are with BVM are 94%.
94%.
Okay, so what's it's not hypoxia.
How
What about
we get a 12
hypovolemia? What's his blood pressure?
0/0.
Okay,
Hypovolemia.
Let's go ahead and start some fluids,
Okay. All right.
and then when we get a chance, we're going to do a 12 lead. See
Okay.
what's
12
going
lead
on.
shows
And-
AFib. Don't even worry about 12
Okay.
lead.
Okay.
Not going to help you right now.
Okay. So we started fluids.
2 inches. I need 2 inches. There you go. That's what I need. That's what I need. And you can do that every 6 seconds. Every 6 seconds. You don't have to wait on her. So now we're getting those labs back, and those labs say what about
No,
what
lab's
about
not back yet.
labs
I
not
don't know
back
what
yet?
I haven't heard anything about labs.
I've speeded that up to every 6 seconds rather than waiting on the 30 second or the 30 pump breaks.
What is the how are we supposed to do it?
30 and 2, but once you get that in there,
No.
oh, that's not. So I just killed my patient.
Mm-hmm.
I told you.
You didn't kill him.
Yeah.
Hey, he's kinda,
He didn't kill him. He's dead.
you
Let's
can't
go
kill
30
dead.
and 2. Advanced
No.
airways theory,
All right.
yeah.
Okay, so it's still 30 and 2. It's 30 and 2.
So let's regroup. Let's regroup so we can try
Are
to
we
save the
stopping?
band live. So let's regroup. Get everybody back where they need to be. Is she doing good CPR? I don't think so.
Why don't y'all swap out? Why don't you do this for a while? 30 and 2. We've given the.
Are you laughing?
Are you laughing at me?
A little bit
He's
higher.
laughing at me. I knew they were going to be laughing at me.
You're good. Come on, go.
Okay, so we've given epi, we've given the amiodarone, and then we've given vasopressin, so amiodarone is ready for the
amiodarone
for the next one. But this one's only going to be 150.
Correct.
And so we're going to keep the.
So let's reevaluate. So let's reassess. We'll start.
We've got to go through those H's and T's, but we don't have those labs back yet. So I don't know.
2 minutes is up.
2 minutes stop. So let's reassess. Let's reassess. We're going to check his blood pressure. We're going to check his vital signs, and now we're
blood pressure 0/0.
Still no blood pressure, and we're VTAC. We still need to.
Okay.
So let's go back to your compressions. Go back to your compressions. We administer the amiodarone 150.
I've already given you amiodarone.
Already did that.
Look at your chart. Help you out. Come on, people.
Okay.
Let's be working together.
And this is we're gonna give him 150 to start with, and everybody's clear.
1, 2, 3.
Shot.
Shock administer. Go ahead.
Let's go back to
Okay, so now CPR starting again. Your 2 minute starts.
And it looks like we had some kind of effect. We've done something. Oh, that's just you. That's just you. Next, we're going to do epi at. Yeah, we're going to do epi again at 1 milligram at the next.
How's that CPR?
Yeah, let's keep that up. CPR. We have to. Your 2 minutes is not up yet.
Oh no, you're only 25 seconds in.
Can you swap with her?
Well, we gotta wait for
Tired?
Yes.
She's telling you she's tired, but she can't swap now. I mean, you're in 2 minutes, man. She's got to do it. She's got to work through it. Dig deep.
We're going to set the defibrillator for the next time for 200. We've got epi ready.
Did we go through their H's and T's?
We're still waiting on labs. Still waiting on labs. Still hunting labs. Still hunting labs. So maybe there's something here that's not affiliated with the labs.
Okay.
Hypovolemia. We don't see any blood loss. Hypoxia. My blood is.
You probably thrombosis.
Okay.
So CPR, yeah, CPR and epinephrine, just epinephrine every time, because we don't have any. But they're shockable.
We're going to give him 1 milligram epinephrine next time?
Yes, 1 milligram epinephrine, and we're set up to shock at 200 joules whenever we get there. And we're about 10 seconds away. Y'all are going to swap out.
2 minutes.
Yeah, it is a long time, especially if you don't. I mean, I know.
All right, 2 minutes is up.
2 minutes is up. So we're going to assess a patient.
So you have a pulse?
No pulse.
No pulse.
We're going to continue CPR.